Hi, this is Dr. Randy Hurst, clinical psychologist. I've been doing a number of videos and realized that despite the fact that I've referred to a plan to talk about depression, I haven't really done it. It's very complicated in that my hesitation is because of how complicated it is. A person can be depressed because of acute reactions to things that have happened in their lives. A loss, a divorce, a death, a trauma of some kind, a loss of work, potentially the loss of a career through injury or some other thing, the loss of freedom. There can be so many things that take people to a very bad place. Stress, focus on what they've lost, say physical disability or changes that make it impossible. Then of course, that's acute. So if you had something bad happen and you go through a period of dealing with either the grief, the anger, the loss, the kinds of things that people go through to get to a place where they can go on. But also, just the chronic stress of going through that adds to the effects on the body and to the level or the kind of depression. Now it's not just about psychological re-understanding, sorting through, making sense. It's about how the body is reacting. I learned an interesting thing. I'll tell you about some of it later. Refer to a biomedical researcher who's done a podcast. What I didn't realize is that actually people, when they get major depression like that, particularly with the chronic stress, will have a fever. Now, I'm not sure that it's really a full-fledged fever, but it's higher than normal body temperature because of part of the way the body is revved up for dealing with the stress levels. But the other, a real big issue for my hesitation is that there are dozens of medical conditions that present with depression, with things like fatigue, feeling down, just no energy, just having a very negative view, including particular things like feeling suicidal. So, for example, some autoimmune disorders, one that I know from family, although some of this doesn't fit, but celiac disease, which is a reaction to the gluten that's in wheat, barley, and rye, for some people can particularly cause gastrointestinal issues, but also depression. Partly, possibly directly, a cause of depression, but also partly because it can cause nutritional disease or nutritional deficiencies. And the nutritional deficiencies can cause depression. Low vitamin Bs, especially the B vitamins, 6, 9, and 12, can lower one's energy and just have a kind of effect that people feel depressed, feel that loss of energy, feel down, and just get negative or overstressed. Lupus is another autoimmune disorder that can cause depression. Cancers can cause depression. Usually, hopefully, a person might know that they have cancer. And you could think, well, maybe having cancer causes the depression. No, it turns out that the actual disease process can cause depression. Diseases like Lyme disease, toxoplasmosis, West Nile virus, syphilis can all cause depression. Of those, I don't know if any of those are really common. If somebody who has cats possibly could be exposed to the feces in a way that can cause toxoplasmosis, which is definitely a risk for pregnant women, but also it can cause depression in people. Anemia, low iron levels, really lower the energy level and have other direct effects on the endocrine system, the whole body system that sets up for depression. Thyroid disease. That's probably, of the ones I'm going to talk about, that might be one of the most common that I would see in clinical practice, where I see somebody who comes in wearing heavier than typical clothing for the temperature in the room, having low energy, feeling cold, thick hair. Those can be suggestions of low thyroid, which can directly then be experienced as depression. Insomnia, sleep apnea. Maybe sleep apnea is actually the most common that I might see, especially in somebody that's a bit heavier. It sets up for low oxygen levels at night, sets up for gaining weight, lower metabolism levels. So eating the same amount might cause a person to gain weight. The extra weight causes worse apnea, which sets up for low energy, sleeping in the middle of the day, having a hard time getting rested sleep at night. Again, depression. Circadian rhythm issues, where somebody has an off sleep cycle, wake sleep cycle, and they force themselves outside of what is the most stressful for their system, and which sets up for stressing the body, which again, depression. I've had 4 people for sure, and another one, and possibly another one that I should have wondered, had pituitary tumors, and which it turns out are not as uncommon as you would think. They are uncommon. You don't see it very often, and in 30 years of working with people, to have recognized 4 or 5, it still isn't a common thing. But again, the way that I saw it was just absolute leaden depression, utter fatigue, to the point of hardly being able to move. Yet, if they were in a anger-making situation, become absolutely untethered in terms of high energy level. And it was just this odd extreme. And so sometimes brain tumor, pituitary issues can set up high cortisol levels. I mentioned it earlier with high stress, low adrenaline levels, all set up for depression. I mentioned nutritional, and I mentioned the vitamin B vitamins, but also low vitamin D. Very much indicated causes depression. Fatty acids, essential fatty acids, like the fish oil kinds of things, sets up for feeling depressed. Tobacco smoking, oddly, this is one I hadn't quite known. But again, you're having low oxygen levels. It's a strain on the heart. There's a number of issues that can be going on. Don't know the details there. I just know that in reading about it, it sets up for depression. And then light exposure, having very low levels of light. Or these days, with all of the computer screens, having high levels of blue light, revving up the system so a person's got insomnia, has a hard time getting to sleep at night, and messing with their sleep-wake cycles. So these kinds of complications make it difficult to know, are you dealing with just a psychological disorder, or is there really a physiological disorder that is hugely important to treat first as the primary? And because talking about everything, kind of working through strategies, won't work if all of the medical stuff is still kicking in. Speaking of that, I forgot about restless leg syndrome in terms of sleeping problems. It can have a huge effect on messing with the sleep cycle and causing depression, or adding to insomnia, causing depression. Well, hypoglycemia, having just low blood sugar wearing on the system as well. So one of the things about medical conditions, they're easier to figure out if they came on very suddenly. But so many of these that I've talked about come on very slowly, very insidiously, and are hard to figure out. So it's easy to pin the problem on the stress in my job, or my unhappiness in my marriage, or other relationships. Those kinds of things, so a person can present to me, and we can start working on all of that. But I learned to become very aware that it could be physical too, and to look for problems in mood that are unrelated to the stresses that the person is focusing on. Had a boss actually who had seasonal affective disorder, another thing of depression, where it happens in the winter. It's because of light levels, and she would focus on family problems and relationship problems that turned out that they only happened, or she had them all year long, but it turned out she only was down and depressed and just terribly affected in the winter months. So getting that treated with light therapy ended up helping everywhere. It didn't change the things going on with family, but it did change her own mood and her own way of feeling able to cope. The key to dealing with these kinds of things is to not to diagnose yourself, but to notice patterns. And in fact, I encourage people to notice in a formal way with a calendar or some way of marking mood levels, and look for time of day, time of week, time of month, time of the year if it happened to be a seasonal thing. Look for what makes it worse, or what seems to have been happening where it might have been better, in case it's a food issue. And keep this and notice patterns through time while you're waiting for your doctor appointment possibly. And don't bring your diagnosis to your doctor. They'll wonder cynically, what medical school did you attend? And they won't take you real seriously. But if you bring in your symptoms and basically say, doctor, what could this be? That helps them get a good set of symptoms, a good set of a sense of the patterns, and you're really asking for their expertise. So at this point, what I'm going to do is let it go with that idea, those ideas that could be medical, and how to approach your doctor about it. And in subsequent videos, I will talk more about things that can be done from a psychological standpoint. Hope these help, and hopefully you don't have any of these things, but if you do have a pattern that doesn't seem to have that much of a connection with the events around you, consider the possibility that there might be a medical reason. Okay,